it's a pleasure to share how the Social Innovation in Health Initiative was a catalyst to advance our program called Mamás del Río, or Mothers of the River. And it will also be a pleasure to continue this presentation in Spanish, my native language, which I rarely have the opportunity to use at international conferences. Soy de Perú.
I am from Peru. In Peru, there is 4 times more neonatal mortality and 2 times more maternal mortality in rural areas as compared to the rest of the country. Most of these deaths, maternal and neonatal deaths, can be prevented. Loreto is a region located in the Peruvian Amazon. I work there, and in that area, 55% of newborn deaths are not recorded. This happens because when a baby falls ill, often the mothers do not take them to the health facilities because this is a long trip, takes hours on the river, it's expensive, and it's dangerous. When these babies pass away, they are buried in community cemeteries like these, and they were never therefore given an identity card. So it's as if these babies had never existed. Most of the deaths that occur in most maternal and newborn deaths take place because the deliveries take place at home. They give birth on the floor. There is no skin-to-skin contact between the mother and the child. There is no early breastfeeding, and more than 50% of mothers throw away the colostrum, which is the initial milk that comes out from the breast, because they think that it can harm the baby. I saw this firsthand when I was working as an epidemiologist, researching infectious diseases in the Amazon. During that time, I became pregnant with Silvana first, who's in this picture, and then I became pregnant with Ariana. Being pregnant and giving birth in the Amazon meant that I not only saw how it happened, but I also felt in a very intense manner the huge disparity between access, the disparity of access to medical services for women in rural areas. Being a mother in this environment meant that I knew that I had to do something to help them. I had to help them close this gap. That is how, thanks to competitive financing from Grand Challenges Canada, the Government of Canada, and the National Council of Science and Technology in Peru, we were able to launch Mamás del Río, Mothers of the River. I called the project Mothers of the River because it reminded me of the mothers who would wait alongside the rivers when we arrived at the communities. Mothers of the River has become an innovative social health project. So what is social innovation in health? In a recent review that we carried out, we found that social innovations in health have 4 characteristics. The first is that they seek to meet the need of a community in terms of health. Second, they're created through a collaborative process with the communities. There's also a shared leadership with the communities. And fourth, they have an impact on health systems. Now, all of this sounds wonderful. We can see, or we can understand social innovations as seeds. If they're not taken care of properly, if they're not watered, they die. However, if they are supported, if they are watered as we were supported by CHI, they can grow and flourish. Today, I'm going to tell you how Mothers of the River began and grew, and how the Hub of Innovations for Latin America helped us reach this point. But first, to understand all of this, what does Mothers of the River do? Mothers of the River is a program seeking to improve the health of mothers and newborns in rural, remote and indigenous areas and communities in the Amazon. We do this thanks to community health workers, men and women who have tablets and digital technology. Using that technology, they visit the homes of the mothers and newborns, giving them information about the care that they should receive during the pregnancy, the birth, and the few days after that, which can truly make the difference between life and death. The community health workers also use the tablet to collect information, which is then sent to decision makers. Mothers of the River also trains midwives and other health workers, and we seek to raise awareness in the community, and we explain the importance of taking care of the mothers and the children. We started in 84 communities along 3 rivers with a combined distance of 350 kilometers. Then, thanks to the financing of the Ministries of Foreign Affairs of Peru and Colombia and the Inter-American Development Bank, we were able to spread along the border between the 2 countries and create Mothers of the Border rather. So we now have 30 communities along the 4 districts, 2 in Peru and 2 in Colombia. We have just received financing for the next 2 years, and this project not only focuses on the health of mothers and the newborns, but also works on family planning to avoid teenage pregnancies, and also focuses on violence against women, which is higher in rural areas. We carried out an program evaluation, which showed that this program improved almost all of the essential care indicators relating to thermal care of the child, umbilical cord care, and breast milk feeding. This publication was recently sent to the Lancet. Mothers of the River also helped increase the number of institutional births, improving the lives of 1,500 mothers and children. So how did the Hub for Innovation, the Latin American Hub, help catalyze our project? Now, I have to admit that the first time I read about social innovations in health was when this hub was calling for projects in the region. When I was reading about the conditions to see if our project qualified, I realized that we were actually already working on a social innovation in health without knowing it. Therefore, we applied, we won, and the hub has since then given us many tools to continue to grow. First of all, it made us more visible. The Latin American Hub organized the award ceremony that year, and it took place in PAHO in Washington, D.C. And it was organized by the director of PAHO. And this made us visible on the international stage. We were not just another project. Moreover, they traveled to the communities to carry out a case report, which is on the TDR website. And they made a wonderful documentary which tells the story of our project so well that we use it as an explanatory video. In the video, you can hear the voice of Regner Kuritima, a health worker who never wanted anyone else to go through what he did, which was the death of their child, who would today be 8 years old, because they did not want anyone else to go through such a horrible experience. The documentary also has drone shots of the rivers, showing the immensity of the rivers, but these are the kilometers that separate the women from the health facilities. The hub also coordinated a podcast with Global Health Matters. We talk about our project and social health innovations. It also gave us the opportunity to present in international conferences, and we had an interview with the British Medical Journal. This is a very important journal in the scientific world, but we know that reaching the academic world is not enough. That is why the hub highlighted the importance of disseminating information, because broader audiences, the public, can also be drivers of change. In Mothers of the River, as Mothers of the River, we have had many different interviews, and we have managed to access and speak to more than 5 million people. With the States of the United States, we have a reciprocal sharing where we talk about the experience of the results that we had in Mothers of the River and how those results and how that project could be transposed in Alaska and the United States, where they also have a higher maternal mortality rate than in the rest of the country. Now, I'm not sure if you've heard of Duolingo. It's a phone application to learn languages. Well, you can also find us on there because we have told the story of how Mothers of the River was created. So if you want to learn Spanish, you can find us on Duolingo. We've also tried to reach children. We wrote a chapter in a children's book where we not only talk about Mothers of the River, but we also encourage girls to follow the path towards science. Apart from communication and dissemination, we also thought about design and sustainability, which is so important in social innovations. We also thought about community-based participatory research methodologies, which we have implemented throughout the program. In fact, the tablets have digital stories which were created by the community itself. And once you're on this story, you have the narration of all of the different communities along the river. The Latin American Hub and the Global Hub also highlighted the importance of gender in social innovations for health. Because this global vision is incredibly important. In Mothers of the River, not only have we looked at the impact of access to health services for rural, indigenous and remote populations, but we've also designed a project which seeks to mitigate these challenges. The hub also helped us network in person in Cali. That is where we met other researchers and we were able to share our experiences. They also organize a virtual cafe every 2 months. I actually just moderated one about the Observatory on Mortality in Mexico. The hub also gave us the opportunity to take part in different health conferences as well. This year, with the Latin American Hub, we had an exchange of innovators within the country. There we traveled to the Amazon in Colombia, and we learned about this project called the Song of the Toucan. Throughout the pandemic, they created indigenous communicators. We went to the place where this project was created, and we told them about the challenges that we had faced and the lessons that we had learned. And speaking to Paulo Montoya, who was the innovator and the head of this project, we realized that we could implement their project in our part of the country and our project in their part of their country because we had the same challenges. Mentorship is essential. This is my mentor, Dr. Luis Gabriel Cuervo. He is a leader in the Latin American Hub and also works in PAHO. I met Dr. Cuervo in the Innovators meeting in Cali. There we developed a mentorship relationship which has truly enriched my life, both academically and personally, over the last 4 years. He has given us advice to make our project more sustainable, steps that we should take with our project to mobilize more resources. And with him, we were part of a podcast. We've also presented in various conferences in English and in Spanish. We have had various publications in English and in Spanish in different journals, and we have created a network of collaborators, which is key for our program. We are also writing a proposal for a documentary with him, which would help people understand the gaps and the lack of access that rural women have when they're trying to access health services, and hopefully that will win us an Oscar. The hub also highlighted the importance of research to direct policy. Mothers of the River the story can also be told through different publications. This is, for example, in the Lancet or the British medical journals. And we hope that Mothers of the River can be implemented as a public policy in our country.
Y es que Mamás del Río pertenece
Mothers of the River is part of this big family, the public health innovations, whose goal is to have a real impact and to train innovators in the various regions. This hub and this initiative has 13 hubs and numerous collaborators throughout the world. The CHI has helped launch 20 initiatives in 7 countries, and it is changing the life of people there through training people, health communication, digital health, and access to health services through intercultural dialogue. Mothers of the River is a project that's very different from what I did before as a researcher. Now, Mothers of the River doesn't exist to answer an academic question, but rather to respond to needs in communities that I've seen directly myself. And that is the goal of social health innovations. Thanks to the Social Innovation Hub, has shown us that it is possible in an entire community to create change for mothers and newborns and the entire community. I found my home, my family, and my purpose in that region. And Silvia and Ariana, with them in my belly, where I was pregnant with them. And now, together with them, we go over the same rivers that I have worked in for so long. Thank you.